My name is Tony Kristen Walker, and I'm the Director of Prevention and Community Partnerships for AIDS Alabama. AIDS Alabama is dedicated to eliminating new HIV infections and improving the health and well-being of those people who are living with HIV. No one could have predicted the way that we had to adapt to the ongoing pandemic. We had to adapt and adapt quickly. Because of this, we were able to continue with a vast number of our services by using telemedicine for in-person visits such as social work intake and mental health visits. For services that require direct contact, we use PPE to ensure the safety of our clients as well as our staff. Just before the pandemic, we had a client who lived about 2 hours away from Birmingham, and because of disclosure issues, wanted to have their services done here in Birmingham. The client and their newborn were both living with HIV, but because of being newly diagnosed, neither of them were virally suppressed. The client lost access to their transportation, and because they had another child, they were unable to use traditional forms of sponsored transportation. We were able to use Ryan White funding to provide transportation to and from multiple appointments. And when the baby was hospitalized for a short time, we were able to provide temporary housing. There are many needed resources, and better access to care is one of the most important. Access to care includes transportation, being able to afford and receive your medications, having adequate housing, and other supportive services. These are all areas in need of massive investment. If I could say one thing to the people who are making the decisions, it would be listen to the voices of the people who are in need. They know what they need best.